Now I'd like to go over the prescription drug plan, also known as a PDP or Part D. Now the PDP, the Part D drug plan, these are plans offered from private companies, but they have to be approved by Medicare. So Medicare has to approve these plans, but they're offered by private companies. The way it's structured is it should be similar in structure to what you're familiar with, where you have a drug plan, and in this case, you'll pay a monthly premium to have that drug plan. If you go with the Medicare Advantage plan, the monthly premium will be built into the Medicare Advantage premium for your drugs. If you decide to go with a Medigap, you'll pay a separate monthly premium to have the Part D drug coverage. When you have the Part D drug coverage, you also pay a copay for each prescription that you take. Well, what is that copay? Let me give you my favorite answer, and that answer is it depends. The Part D drug plans are structured by tiers. The tiers are generally generic, brand, and non-preferred brand. Whichever prescription you're taking should fall into one of those tiers, either generic, brand, or non-preferred brand. And then whatever tier that falls into, you'll pay a copay. Usually generics are the lower cost, and then the non-preferred brand are the highest prescription drug costs. With the Part D drug plan, Medicare has set certain limitations. They have what's called the initial coverage level. With the initial coverage level, you order your prescriptions. You can go to your local pharmacy, order 30 days. Maybe you prefer to do 90-day mail order. That's okay. If you have a preference, let your benefit advisor know so they can find a plan that allows you to still have that service. You'll pay a copay for those prescriptions when you take them. Medicare has set a limit. The limit is known as the donut hole. It's at $2,970. When you hit the donut hole, you have a coverage gap, which means you go from paying a $1 copay to a coinsurance, to a percentage. When you hit the donut hole, you pay 47.5% of the retail cost of your brand name drugs, and then you pay 79% of the cost of your generic drugs. Once your out-of-pocket costs hit $4,750, that's when you hit catastrophic coverage. Now, before I move on to catastrophic coverage, there's an example that I'd like to do just to make sure that we are all on the same page. Let's say that Mrs. Jones goes to her pharmacy and she orders a 30-day supply of Lipitor. And let's say that she's not yet in the donut hole. Well, what will happen is she'll pay a $1 copay for her generics or her brand or her non-preferred brand, but that's not the retail cost. So let's say that she orders Lipitor, and let's say her copay is $40 for a 30-day supply. Now, even though she's paying $40, is that the retail cost of the drug? The answer to that is no. She pays a $40 copay, a discounted copay. The retail cost, let's say, would in this case be $100 for 30 days. But she just pays $40 because she has insurance. Now, with the Part D drug coverage in that donut hole, the retail cost is what counts towards getting you into that donut hole. So you have that limit of $2,970. In this case, with the Lipitor that Mrs. Jones is taking, the $40 copay that she pays would not count towards the donut hole. The retail cost would be. Remember, I said in this case the retail cost of Lipitor for 30 days would be $100. That $100 retail cost is counting towards that $2,970. It's based off of the actual retail consumption and not what she's paying out of her pocket. Now, when she hits the donut hole, then she pays 47.5% of the retail. Let's say that she's still ordering that Lipitor, but now she has to pay 47.5% of the retail cost. Well, in this case, we're saying that Lipitor retail would be $100 for 30 days. If she has to pay 47.5% of $100, that would bring her copay up to $47.50 for a 30-day supply. Now, that's just an example, so you have a point of reference to understand that. And then if you're a high utilizer and you use a lot of prescriptions, you can hit the catastrophic limit. To hit the catastrophic limit, you hit the limit of $4,750. If you hit catastrophic coverage, then you pay $2.65 for your generics, and then you pay $6.50 for your brand name drugs, or you pay 5%, whichever is the greater amount is what you would pay. Now, if you are concerned about making this transition and you're concerned about your prescriptions, that is why you have your benefit advisor. Your benefit advisor can do the analysis with your prescriptions. If you call them and talk to them and you educate them a little bit as far as what prescriptions you're taking, they can do the prescription drug analysis, and they can let you know if you come close to hitting the donut hole. If you do hit the donut hole, what plan would be the better plan for you, and they can let you know how much you would expect to pay for that year. Now, we've outlined a 3-step process to help everyone with this transition if this is the transition they'd like to make. The first step we offer is educate. The second step we have is evaluate and enroll. And the third step is manage. We're here to help with this transition right now, but we'll also be here for the future. So if you have issues with doctors, claims, premiums, co-payments, let Extend Health know. That is what we are here for. Now, you may not have yet received this yet, just depending on when you're listening to this call, but you will receive an enrollment guide. The enrollment guide will be your introductory piece of information to what is available through Extend Health. Now, please keep in mind the enrollment guide will not have specific rates and it will not have specific plans. It will let you know a little differences between the Medigap and the Medicare Advantage, kind of like what we just went over. If you set up an appointment with your benefit advisor just to consider your options, and this will have your appointment confirmation letter in there. Now, if you would like to consider this as an option, I would recommend calling Extend Health and setting up an appointment with your benefit advisor. The phone number to do that is 855-835-3863. That is a Georgetown University specific phone number, which means we know anyone calling from that phone number is a Georgetown University retiree or at least a spouse of a retiree. Again, that phone number is 855-835-3863. You can schedule an appointment online with a benefit advisor at www.extendhealth.com/Georgetown. If this is a transition, an option that you would like to consider, I would gather your prescription drug information, gather your doctor information, any information you think we need so that you educate us on how you use your insurance, and then call Extend Health, provide us that information, and we can set up what's known as an enrollment call to help go over your options. Now, there's something that I'd like to point out, and this is a very important part of this. So if you take away anything from this phone call, this is what I would like this to be. And that is, if any of you have any pre-existing conditions, if you have cancer, if you have a chronic illness, whatever that condition may be, that will not negatively impact your choices or your premiums if you make this transition. If you have any type of illness, any condition, the insurance company cannot decline you coverage and they cannot increase your premium because of those pre-existing conditions. Everyone making this transition, if they would like to make it, will receive the lower premium available for their age and will receive all the options available for someone that's their age as well. Now, there is one caveat to that, and that is if you do have end-stage renal disease, ESRD, which is a condition that does require kidney dialysis. So if that is the case, call your benefit advisor. There still are options. They just are alternative options designated by Medicare that you'd have to talk to your benefit advisor about. Now, for those of you that do like to use the internet, we have our online web service that you can use. This is so you can have a jump start. Again, that website we have is www.extendhealth.com/Georgetown. If you decide to use our website, we have two options on there. We have what's known as the Help Me Choose option, and then we have the Prescription Profiler. The Help Me Choose option will ask you a series of questions. And once you answer those questions, it will direct you towards a Medigap or a Medicare Advantage. If you use this tool, I would recommend still consulting with your benefit advisor because the benefit advisor may be able to provide insight that is not available on the website. I also would like to point out, if you were to go online today, which today is October 5th, the rates would still not be updated. Medicare has not yet updated those rates or those plans. These would be 2012 rates, 2013 rates still have not yet been updated. We also have what's known as a prescription profiler. The prescription profiler is a tool where you can go online, enter your prescription drug information, and this will analyze the plans available to you in your area. It will let you know the plan that is better for you in cost and flexibility and the plan that covers your prescriptions. Again, if you were to go online today, you would see 2012 plans, 2013 rates plans have not yet been updated. The best part about our website, you don't have to use it. All of our benefit advisors have these tools in front of them. They can do the needs analysis on the phone and they can help you choose a plan. They can narrow down your options to a Medigap or Medicare Advantage. They can also do the prescription profiler analysis for you. They can gather your prescription drug information over the phone. They can put it into our database and they can analyze it and help you find the prescription drug plan that fits your needs specifically. Again, let Extend Health do that heavy lifting for you. These are services that we offer just to make it more convenient for you so you don't have to filter through all this information and do all this work. Our benefit advisors, the average age we have is 43 years old, so we have a more seasoned, a more tenured workforce. A lot of our benefit advisors have been involved in insurance prior to coming to Extend Health. We have a service center in Salt Lake City, Utah. That's our main service center. We have 2 service centers in Richardson, Texas, and then we also have another service center we just opened in Houston. So all of our benefit advisors are located within the United States, and we all speak English. Now, if you by chance are hard of hearing, or if someone does have an accent and you're having a hard time understanding them, that is okay. Just let the benefit advisor know that you would like to talk to someone else. I've had it a couple of times where because I'm a male, I have a deeper voice, and sometimes I'm easier to hear on the phone. So if you're kind of hard of hearing and you get someone you're having a hard time understanding or hearing, let that benefit advisor know. We can definitely accommodate that if that is a situation. Now, your benefit advisor is your objective advocate. Their job is to make sure that you get put in the plan that is best for you. Your benefit advisor is your best friend. You just don't know it yet. All of our benefit advisors are neutrally compensated, which means they have no incentive to put you in one plan over a different plan. There's no incentive for the benefit advisor to put you in AARP instead of Aetna. Again, their job is to make sure you can put in the plan that is best for you. They receive an hourly wage, and that hourly wage is the same no matter what direction you go. All of our benefit advisors are licensed, certified, and appointed. The benefit advisor has to be licensed in the state in which they live. Moreover, they have to be licensed in the state in which you live. They have to be certified with the insurance carriers. Last year I did about 40 to 45 different certifications just to stay up to date with the carriers. All of our benefit advisors go through Extend University. It's a 6-week program where we learn more about Medicare than we'd ever hoped to learn.